This video will help you understand sickle cell disease, how it develops, its symptoms and complications, and how it is treated. Sickle cell disease is an inherited blood disorder that causes abnormal red blood cells, known as sickle cells. Normal red blood cells are round and flexible and flow easily through the body's blood vessels. Red blood cells have an important job. They carry oxygen to all parts of the body. People with sickle cell disease have red blood cells that become hard, sticky, and shaped like a banana or a sickle, a type of farm tool. If red blood cells become sickle-shaped, they can clump together and block tiny blood vessels. This keeps blood and oxygen from getting to the body's tissues and organs like it's supposed to. Sickle cells also break apart more easily than normal red blood cells. The medical term for this is hemolysis. Hemolysis causes low numbers of red blood cells, or anemia. Without enough red blood cells, oxygen can't be delivered to the body as well. Sickle cell disease is inherited or passed down from parents to children. It is caused by a change or mutation in a gene that gives the instructions for making hemoglobin. Hemoglobin is the protein in red blood cells that carries oxygen. This mutation causes the body to make abnormal hemoglobin, called sickle hemoglobin, or hemoglobin S. Sickle hemoglobin clumps together inside red blood cells and forms long, stiff tubes. These tubes stretch the cells into a crescent or sickle shape. A person with one sickle hemoglobin gene and one normal gene has sickle cell trait. They don't have symptoms of sickle cell disease, but they are a carrier, meaning they can pass the gene on to their children. But if both parents have the sickle cell trait, their children have a chance of getting 2 copies of the mutated gene, one from each parent. A person who inherits 2 copies of the mutated gene will develop sickle cell disease. When both parents have sickle cell trait, the chance of having a child with sickle cell disease is 25%, or 1 in 4, with each pregnancy. Sickle cell disease is most common in people whose ancestors come from certain parts of the world, including African countries, Saudi Arabia, India, and Mediterranean countries such as Greece, Turkey, and Italy. Sickle cell disease is often diagnosed through a blood test during a standard health screening when a baby is first born, called newborn screening. Newborn screening is not available in all parts of the world. Sickle cell disease may be diagnosed by a blood test after a child has symptoms. Early diagnosis of sickle cell disease is important so that treatments can be started early. Sickle cell disease can cause a variety of health problems throughout the body. Sickle cells can block tiny blood vessels that deliver oxygen to important organs. This can result in complications such as pain, fatigue, infections and fever, joint problems, stroke, and damage to the eyes, brain, heart, lungs, kidneys, and spleen. Health problems can be different from person to person and can change throughout a person's life. Because of these health problems, people with sickle cell disease have a shortened life expectancy. Sickle cell disease is a lifelong condition. Ongoing medical care is needed to prevent and treat complications of the disease. It is important to seek care from a sickle cell specialist. Medications for sickle cell disease depend on the patient's age and specific medical needs. Options may include penicillin and immunizations to help prevent infections, hydroxyurea to help red blood cells stay round and flexible and not become sickle-shaped, pain relievers to manage pain during pain episodes, and other medicines. such as L-glutamine or crizanlizumab, to help prevent inflammation and damage from sickle cells. Some patients may get blood transfusions to replace sickled red blood cells with healthy red blood cells from a donor. This can improve symptoms and help prevent stroke or other complications. A stem cell or bone marrow transplant may be an option for some patients. This works by replacing a patient's blood-forming stem cells with healthy cells from a matched donor. A biological brother or sister is most likely to be a match, but a parent or unrelated donor may sometimes be used. A stem cell transplant can cure sickle cell disease. However, most people with sickle cell disease do not have a suitable donor for a stem cell transplant. A stem cell transplant is a major medical procedure and can have serious side effects. Newer gene therapies are also being studied as a treatment option for sickle cell disease. Gene therapies work by adding, changing, or repairing the hemoglobin gene in a patient's stem cells. Many patients who have received gene therapy no longer have severe symptoms or need regular treatments. However, gene therapy is new and is only available in certain specialty hospitals. It still needs continued research. People with sickle cell disease are not sick all the time. They can live mostly normal lives, go to school and work, and have a family. But it is important to help prevent problems and take steps to stay as healthy as possible. See your healthcare provider regularly. Take medicines as instructed. Get recommended vaccines. Take steps to prevent infection. Avoid pain triggers. Talk to your care team about how to manage pain episodes when they occur. Practice healthy habits. Be physically active. Eat a healthy diet. Get enough sleep. And manage stress. Avoid smoking, vaping, and alcohol use. People with sickle cell disease and their caregivers should seek medical care right away for any of these symptoms: fever, severe pain, coughing, chest pain, or trouble breathing, weakness or numbness on one side of the body, confusion, trouble seeing, speaking, or walking, fatigue, weakness, or dizziness. A diagnosis of sickle cell disease can be overwhelming. Every family has a different journey, but you are not alone. Now that you understand the basics of sickle cell disease, look around the Together by St. Jude online resource for more in-depth information. And please remember, we are here to help you face sickle cell disease together.